Hello, my name is Tracy Trulove, and I'm the Pitkin County Incident Management Team Public Information Officer. Welcome to our third community meeting, and thank you for joining us. I'd like to go ahead and introduce who the panel will be today, and then I will remind our panelists to please reintroduce yourselves when it's your turn to talk, as that will help our radio listening audience know who's on the line. So today joining me is Pitkin County Public Health Director Karen Kenneman, Pitkin County Sheriff Joe DeSalvo. Aspen Valley Hospital update will come from Dave Ressler and Dr. Catherine Bernard. And then we have Michelle Musing with the Hope Center. And then I'll be wrapping up the meeting with an update on a little more information about what the incident management team is and what the Emergency Operations Center is and what we are working on in this COVID response. So with that said, I'm going to go ahead and kick it over to Karen, who is going to kick off our meeting. All right, team, we're working out some computer glitches, and as soon as we do that, we'll get started with Karen.
All right, let's give this another shot. Good afternoon. Can you hear me now?
Yes, we got you, Karen.
Great. Okay. All right. So, thank you to all the folks that are sitting on this virtual panel, as well as to the residents in our community that are listening in. I want to start with just a brief overview of where we are to date as far as our public health strategies for really combating the spread of COVID-19 in our community. And we're going to hone in on the public health order today and to talk a little bit about the intentionality of this order, as well as the changes that are now coming to bear. So for context, really the public health order it's a blunt tool which really blankets and impacts the whole population to help slow the spread of COVID-19 illness in our community. It really does truly impact every single facet of our community, from how we go about our daily lives with our families to businesses, and has a far-reaching impact long after COVID-19 is taken care of globally. And I just want to put some context to that, in that this is like really, really, really hard. And I think Aaron said the word, this really actually frankly sucks. And I just want to thank every single person out there right now that everything you're doing to comply with this order, everything you, your family, neighbors, your friends are doing right now is saving lives. And I think that may sound really dramatic, but it's true. And I just want to thank everybody in this community for taking this seriously and respecting the nature of the public health order, and really what it's trying to do is save people's lives. With that, the magnitude of it is substantial. And so we have continued to tighten up the public health order to make it more restrictive. Currently, the order is more restrictive than the state of Colorado, and there is good reason for that. We believe that the tighter we have this order now, the more we have that blunt tool really coming down on our community, the faster we're going to be able to recover. And so it's hard now, and we hope that being hard now will allow us to get out of this faster in the long run. We also recognize that there are significant uniqueness in our community, and that's really around destination tourism and the drivers of our economy. And so unlike maybe a Front Range community where it's not a destination tourism space, maybe it's okay to keep lodging open, but we really wanted to acknowledge that having lodging open was not a good strategy for our community, knowing that travel is one of the biggest ways that COVID-19 is moving into communities. And the more travel we have in and out of our county, the more chances we're going to have of the spread of this illness. And so with that, we did put in a pretty restrictive public health order the last time around tourism and lodging in particular, to say that this is not a good time to come visit us and to use the tourism kind of mechanisms or world with lodging. The second half of March was typically in a normal cycle. Second half of March was predicted to be about 80 to 85% occupancy. Right now we have nearly zero occupancy. And so, that public health order has been effective in reducing the amount of folks coming to travel into our community when there's not a lot of opportunities to do anything anyway with the stay-at-home order. We also instituted a more strict construction sites being non-exempt from the public health order. There are 255 sites that closed in our community, and I think that's just also a reflection of, thanks to the construction community for taking this seriously, but it also, that number shows that, the amount of construction that was happening in this community, and again, respecting that folks might be coming from other communities to do that work and potentially bringing COVID-19 illness into our community. So I just wanted to reflect a little bit about the reasons why those were included in our last order. For our new order, we are also taking down a little bit of public gatherings. It doesn't prohibit any outdoor activity. It really does restrict public gatherings to groups of 5 or less. And for the purposes of outdoor recreation, we're really seeing that families are, if you're a family of more than 5, you can certainly recreate together. And we encourage recreation with physical social distancing of family or household groups together. But we also want to acknowledge that there are many people here that may not have family to recreate. And so you can still go out with your friends that are groups of 5 or less, but you have to comply with the physical and social distancing that we have put out in the public health order, as well as the hygiene requirements. And so just thinking about when you do go out to go for a bike ride, that you're keeping that 6-foot distance from the person you're riding with, and that you do hygiene going into that activity and outside of that activity. And so really respecting that, yes, I think we really want to allow people to continue to recreate. We understand the value of that, especially in this community around mental health, and to be able to get outside and to have those benefits toward both our physical and mental health, but to still respect the social distancing requirements with that. And so that's been a change of having that group size come from 10 to 5, down from 10 to 5. And then we also I want to talk a little bit about the self-quarantine for 14 days for non-resident owners, homeowners, family, and friends. And I think the message here that I would just like to relay is that really what we're trying to do in Pitkin County is sink the spike of positive COVID-19 test by simply not coming to Pitkin County. And the message I do want our visitors to hear is that we miss you and we value you and sincerely cannot wait to see you again, but right now is not the right time to come here until we can really begin to reverse the aggressive trend of this global pandemic in our neck of the woods. We really need to keep folks from traveling in and out of our community. And there's some really strong reasons why it's not a good idea to come, particularly to Pitkin County right now. What we know is that altitude is not a good place to be when you have a respiratory illness. And so to come and expect that it's going to be an easier place if you do end up getting COVID-19 illness is not true. We really want to acknowledge with respiratory illnesses that being at altitude is a bad idea. We also know that our healthcare system is mighty, but it has a limited capacity. ABH, in its current state has 4 ICU beds. It's a 25-bed critical access hospital, and although it has the ability to surge, it doesn't have the capacity that a larger hospital might. We also know that we have limited resources in our community, so supplies at the markets and pharmacies are already strained, and as with strain on our first responder staff, with EMS and law enforcement. And so the more people that come into our community, the more that strain is apparent. And so we really just don't want population numbers to jump up so that we have more people that we need to serve with limited resources in this community. So again, and when you come here, you're under a stay-at-home order, which means that there's really not much to do anyway. So I just wanted to really express that we do really appreciate the visitors that come to this community. It's what makes a part of it. It helps this community to thrive. And so when this is all over, we really hope that you'll come again. But now is just not a good time to come for all the reasons I just mentioned. So I just wanted to put that out there as far as what the public health order is, how it's changing, and the reasons why behind some of those changes.
Great. Thank you for that update. This time I'm going to move the conversation to Sheriff Joe DeSalvo.
Thanks, Tracy. Good afternoon, everybody. I just want to take a few minutes of your time to update you on what your law enforcement and public safety community is doing at this very unusual time in all our lives. First, I want to make clear that the message that I'm going to deliver today is a unified message from myself, Chief Richard Pryor, Chief Greg Knott, and Chief Brian Olson. The 4 of us got together and spent some time talking about these issues that I'm about to address, as well as we wrote a letter to the community. It appears on Facebook. You'll see it possibly in newspapers in the near future, and I think you'll get an idea of where we're coming from on a public safety level. And I'll read from that in a moment. But first, I'd just like to explain where we are as far as working together. The 4 law enforcement agencies in the Upper Valley are cohesive in this. We are working together not only with staffing and helping each other. We have plans in place if one of our departments seems to get hit with the virus worse than another. We are prepared to loan each other staff. So you may see different uniforms in your community. We're not there yet, but we do have contingency plans for that. Each of the agencies I mentioned have people working on the IMT, which is a structural portion of this incident, and we're all sharing resources when it comes to that. And we also are united, lockstep, in the consistent enforcement of this public safety order that Karen was just talking about. So I'd like to read directly from a letter that we have penned, and then I'll get into more of a free form of what our goals and objectives are. Together, the 4 of us would like to be very clear where we stand regarding enforcement. Many of you know us personally and understand and appreciate our community policing styles. Please take the need to restrict yourself to essential activities seriously, which includes keeping your distance, limiting the size of gatherings, and delaying non-essential activities. Thank you to the many of you that are abiding by the orders. However, you should know that all 4 agencies will be using Colorado Revised Statute 25-1-516 to enforce the Pitkin County Health Order. Sadly, we have seen some behaviors that are incredibly thoughtless as well as potentially dangerous. We will not hesitate to arrest and summons individuals who make such poor choices that endanger fellow community members or first responders. So that is an excerpt from the letter. I hope all of you go to read it. With that, I would like to say that we all feel that this community has been adequately educated on a national and a local level as to what the dangers could be if you violate these orders. The summonses will unlikely lead to jail time, and that is a product of the district attorney and prosecution. But as far as your law enforcement leaders go, we will not hesitate to write tickets, especially to those who are egregiously irresponsible when it comes to the spread of this disease. Of course, we will be reasonable when the time allows, just like we've been with in the past. As far as what we are doing, I wanna just let you know that things around our department is we are trying to keep as much normalcy as we can in the services we deliver to the public. And that means that although we may not be responding to non-emergent calls the same way we used to, and I'm talking about questions about general questions about VIN inspections or car registrations or maybe even low-level property crimes, we may take those by phone, but those are to protect our own public safety workers from potential infection. For the most part, you will not see any change in the service that's delivered to you. We will still be responding to emergency calls. Crimes against people will be at the top of the list. We will be doing as much patrol as we can. Our main goal is to limit contact with anyone who might be infected, and that is to protect us so we can continue to protect you. So we are taking this very seriously, and we are encouraging your compliance. As I said, the emergency calls that you get to our dispatch center will not be affected by any of this. I want to speak personally for a moment. We consider this to be a public safety threat to this community, no different than any others we've seen in the past, whether it be a wildfire, whether it might be a drunk driver on the road, or anything else that comes to this community to hurt any of our residents. People who don't comply with this are considered to be putting other citizens in danger, and summons will be issued and people will be held responsible. In the last 9 days of being quarantined in my home with my wife, I've learned to watch way too much CNN, but I also believe in flattening the curve. I think this is something that will work. I think we can be expected that this will be the new normal for the next 4 to 6 weeks, and I firmly believe that the more time that we spend inside flattening this curve, the quicker we will get back to normal. I really believe that, and I think if we all diligently comply, we'll get there. We need to obey this public health order so we could get back to our life sooner. I believe in a national stay-at-home order. I'm hoping it comes soon. I think that would be the best thing for our country. I think I am living proof that no one is exempt from this virus. So I think we all need to be aware of what we do with our time and who we touch and who we hug after that. I think that's real important. I never thought I'd be in this boat, and every day I hear of more people. So in closing, I would just really like the community to know that between the incident management team and the people that are on it, and they are a combination of people from all up and down the valley, I have complete confidence in them. I think from the beginning we have been ahead of the state and certainly the feds on this issue. I think we were groundbreaking in a lot of the decisions we made. And that's because we listened to our physicians. We listened to healthcare professionals. We listened to Karen and what she was getting on through her means of communication. So I'm very comfortable right now that the community is in good hands under the IMT. However, we are doing the heavy lifting. The community has to comply to the stay-at-home order for this to work. I firmly believe in that. So that's my advice to this community, and I hope we take it. We are listening to epidemiologists, and we do have people on staff that are giving us accurate information. So please comply. I think it's the best thing for us, and we could be out of this by midsummer, I hope. So thank you, Tracy.
Thank you, Joe, for that update from our law enforcement and partners. At this time, I'm going to move the conversation to Aspen Valley Hospital CEO Dave Ressler, and then I'm have Dave pass this off to Chief of Staff Dr. Catherine Bernard. So go ahead, Dave.
No sound, Dave.
Can you hear us? Is ours open? Dave, hold on one moment. No sound there.
Can you guys hear?
No sound, Dave.
Yep, sorry, Dave.
Good afternoon. I'm Dave Ressler. I'm the CEO at Aspen Valley Hospital. And I would like to start by echoing the comments and the sentiments that were offered by Sheriff DeSalvo and Karen Koneman that observationally at the hospital, we are encouraged that we are still seeing relatively slight patient volumes associated with patients that have symptoms that they believe may be associated with COVID-19. We sent out a community letter yesterday and spoke to that confidence that that is growing within our organization, and we've received some questions about just what exactly does it mean when we say slight volume. So as we did last week and I believe the week before, I'd just like to frame the perspective on the numbers of patients in the community that are requiring hospital services by giving you some statistics. And then I'd like Dr. Catherine Bernard, our Chief of Staff, to really color the conversation from a physician's perspective. So since March 9th, when we really first identified the outbreak, the hospital has had 20 patients present that have required 18 of which required admission to the hospital, and 2 were sent directly to higher level facilities at a lower altitude and they were requiring ventilator care, mechanical ventilation to support their breathing. It's important to note that of the 18 patients we admitted to the hospital, all but 2 were able to be, 1 is still in the hospital now, was just admitted recently, and all but 2 others were able to be discharged to their homes to continue their recovery at home or return if that recovery didn't occur, their symptoms worsened. The 2, we did have 2 then that were transferred down to a lower altitude and a higher level of care. So to summarize, we've had 4 patients transferred out of the community requiring ventilator support, and those are our most highly acute patients that we're all working so hard to avoid. And as you know, we've had 2 deaths in the community as well. So that is who we're working for. Those are the lives that we are trying to save. In terms of the number of patients that are presenting to our tent, I think you've heard about that, and that provides me with an opportunity to tell you how that works one more time. And that is, we are here for our community. Our purpose is to serve the medical needs and the healthcare needs of our community during this crisis, as always. And so if you have symptoms that you're not able to manage at home, or if you need help with managing, contact your primary care physician. If you don't have a primary care physician in the community, we have a primary care practice, and you are welcome to contact that practice. Either way, one of those primary care physicians can refer patients to our respiratory evaluation tent, otherwise known as the tent, for further workup by a physician and staff. They can do flu tests, they can check for strep throat, and generally evaluate the patient. If a patient requires further evaluation and potential hospitalization, they can be referred from the tent, to the hospital emergency department. On a daily basis, we're seeing about 3 to 6 patients in the tent, so not a large number, and we're prepared for many more as part of the surge planning that Karen referenced a little while ago. We have a very robust surge plan all the way through the hospital to try to handle an influx of patients that we're all working so hard to avoid. Then, in addition, we are seeing several patients a day in the emergency department as well. So that's what we mean when we say slight or small or low volumes at present. And again, I just want to conclude by saying, please know that we're here to take care of you. We are your community hospital, and we are going to take care of our community, and we appreciate the community support and allowing us the opportunity to preserve our staff and our resources in the event of an influx of patients associated with this virus. So I now have the pleasure of turning it over to somebody who can provide much more information than I can and a physician's perspective, and that is our Chief of Staff, Dr. Catherine Bernard.
Thank you, Dave. I am Catherine Bernard. I'm an MD. I work in the emergency department at the Aspen Valley Hospital full-time, and I am the current president of the medical staff. I spoke to you all last week, but I have to just say, first off, thank you so much, because in Dave's numbers is the real story behind these public health orders. You are doing what needs to be done to keep our numbers in a manageable range. So as he mentioned, we've had 20 patients admitted with COVID-like symptoms. Those patients, and these are the sickest patients, mind you, because thanks to telehealth, your community physicians are keeping the patients with the mildest symptoms at home. I know lots of doctor moms out there are doing the same. Our respiratory tent is seeing 4 to 6 patients a day on average, now open not only weekdays but weekends to provide sort of an interim care area where you need to be seen beyond telehealth, beyond on a phone or a screen by someone. And if those patients are sick enough, they're making it to me in the ER. And of those 20 patients we've admitted from the ER to the hospital, Dave mentioned 4 of those 20 patients have gone to a higher level of care, meaning they were intubated on a ventilator and needed to get out of here to a place with an ICU at lower altitude. So far, we've been able to do that, but if you look at those numbers, that is 1 in 5 of the patients we're seeing is quite ill. I think I'm not trying to scare anyone. What I wanted to try to tell you is the ER is open for business. We are managing these patients, and these patients are ill, but we are able to manage the amount that we're getting because you are following these public health orders. So I really appreciate that. It helps me to do my job, which literally is to try to save people's lives, and you guys are doing it too, so thank you.
Great, thank you for that update, Dr. Bernard. With that, I'd like to move to the Aspen Hope Center's Michelle Muthing. Michelle?
Thanks, Tracy. You know, on these community meetings, you're hearing a lot about public health orders and medical conditions and numbers, but one of the things that seems to surface in a lot of the meetings that people are sitting in is how are people handling their emotions and their anxiety during this time. This is a time unlike anyone has ever seen in this country. Even my 100-year-old grandmother can't recount seeing anything like this. And so we are all doing the best we can. And it is an honor to be part of the team in this community because everybody is doing an incredible job. The mental health impact this is having on people is pretty interesting. My phone explodes every day with questions of, how are you guys doing? Is the call volume going through the roof? And to be honest, it's not. We haven't seen a huge surge. And in speaking with our colleagues at Mind Springs, they say the same thing. We're not noticing a major surge in call yet. And I think we all know that we're still trying to get our bearings. We're still trying to orient to this new world around us, and it's not easy. So the things that we want to make sure that people are aware of is, number one, having a little bit of fear and anxiety during these times is absolutely normal. It is 100% something that the community is feeling, and it is something that all of our caregivers are feeling. Your nurses and doctors in the emergency room went into their fields to save lives. They never expected that something like this might come their way, and they're doing amazing. Our first responders went into their fields to save lives, and they're still afraid when things happen. So this is affecting all of us. So some of the things we would like to share from a mental health perspective is stay on the facts, but stay on the real facts. There's a lot of blogs and emails circulating with such bogus information that we want to make sure we spread facts that are helpful and help to ease some anxiety. So stay on your good websites, the public health website, the CDC website, the WHO. Stay with facts. Keep your news to a minimum. We can consume ourselves with being bombarded with news, and it's going to be anxiety provoking. So keep that to a minimum. Identify what triggers you. Identify what is difficult for you and be able to hold it in front of you so you can manage it, because knowing is half the battle, right? We hear that with everything. The one thing I think that is really impacting this community that we see and hear from everybody is our normal ways of coping have been thwarted. Our yoga studios are closed, our gyms are closed, by God, our mountains are closed. So the things that people are used to as an outlet to reduce stress are really hard to access. But a lot of our yoga studios and exercise studios have things online. They're trying to stay connected. I've never seen such a plethora of resources for what people can have access to help them cope. And I'm going to give you some resource information at the very end. Make sure that you ask for help if you need it. Be prepared for things to happen. One of the things that I want to express more than anything is whenever we get afraid, we tend to get prickly. Be careful and be kind. This is a community where we know every single person in our community, and these are going to be neighbors that you see weeks, months, and years from now. Be kind with your words, because these are people you're going to look into their eyes months from now, and they're going to remember posts that you put out or things that you said in a time of anger. So be careful and help people who are struggling, and then be kind to yourself. Don't beat yourself up for struggling and having difficulty in these times. These are things that, again, all of us are trying to become accustomed to. We have kids at home. We have a lot of parents trying to juggle work and school, and it's something they've never had to juggle before for such a long period of time. And when we look at the emotionality that people have, it's interesting. We talk about in our world, people can tend to become belligerent or difficult to deal with when one of their core 6 basic emotions are disturbed. 3 of those basic emotions are fear of the unknown, isolation, and lack of control. And right now, all of us have those 3 basic emotions disrupted. We don't have control over some of this. We don't know what's coming down the pipelines, and we are all isolated. So I hate the word social distancing because we need to stay more socially connected now than ever. But we need physical distancing, right? Keep up physical distancing, but stay connected to the people that help boost you and disconnect from people that tend to bring you down. Do what's good for you. The other thing is that the IMT that is in place, I don't know that a lot of people understand what they are, but they are here to protect us, and they're doing an amazing job. They were here during Lake Christine. I don't know if anyone knows, they're actually in place every single year during X Games in case some major issue takes place with the influx of 100,000 people. And they're here to keep you safe. And I think, like I have heard other people say, we just need to have trust in the people with the knowledge right now, and they're going to get us through this, and we all know that. Some resources just for people to be aware of. The Hope Center's hotline is obviously available 24/7, 365, and we are getting calls, but mostly it's people who are used to calling us. So that number is always available. Some of the resources I mentioned about yoga studios and things to help us cope. Aspen Strong's website has a list of resources that you can find online that can help you stay connected. And MindSprings has the same thing. They've got a warm line where you can call and talk. Utilize these resources because as this continues, we're going to need to be able to have outlets to talk to people for. So make sure you utilize what's around you and stay safe and stay well.
Thank you very much, Michelle, for that update. And I want to thank all of our panelists for the update today. In wrapping up this conversation, we are hearing several questions around what is the incident management team and what is its function. And Michelle touched on it a little bit, but I'm going to go a little deeper into that. I'd also like to share information with you about the Emergency Operations Center that Pickens County Emergency Manager Valerie McDonald operates. So this is really going to all be in closing. So the IMT and the EOC have a symbiotic relationship. The Pickens County Incident Management Team is a multi-jurisdictional team. It's trained in the incident command structure. That structure is designed to support emerging incidences, and as many of you listeners are familiar with, the structure, if you tuned into Lake Christine fire response that occurred almost 2 years ago now. Also more closely to home, we use that structure to support planned events, X Games being the event everyone is locally most familiar with. Your team, local team, is most often activated for what we described as initial attack. Our team was called out on Sunday, March 8th, after the state identified the first COVID case that had been in our community. At the same time, the Emergency Operations Center was virtually activated to support the strategy, tactics, and operations set forth by the incident management team. Most IMT teams are set up to support the initial call out for about 36 to 96 hours before a complexity analysis is done to determine if a larger team and more resources are needed. In this current situation, there is no backup support from the state or federal level to respond to this incident, as it's impacting every county in our state, and we know it's on the worldwide stage. Our team has been working this incident for about 26 days. As this is a communications-heavy event, on Monday, March 16th, we stood up what is known as the Joint Information Center. This team is comprised of resources from the City of Aspen, Pickens County Public Health, Snowmass Tourism, the town of Snowmass, and Pickens County Communications. So again, a tremendous amount of folks offered up the support of their staff to get a much larger communications effort moving, and that's what we've really been working on. And I'll talk at the very end about the channels that you can tune into for that. We also are in close communication with the Aspen Valley Hospital communications folks, the City of Aspen, and the SCICO, really communications professionals up and down the valley. It's not even just a Pickens County response. We're working with our regional partners. The incident management team is made up of agencies including Pickens County and Pickens County Public Health, the City of Aspen, Town of Snowmass, and Basalt. And the law enforcement and emergency service providers include Pickens County Sheriff, Aspen, Basalt, Snowmass PD, Carbondale Fire, Roaring Fork Fire, Aspen Ambulance District, and the Mountain Rescue Aspen team. Now to move a little bit over to what the Emergency Operations Center is about. It's comprised of emergency support function physicians. They're staffed by subject matter experts to support the incident. This team is also multi-jurisdictional. An EOC is used to support on-scene activities through the prioritization of activities and the allocation of available resources. And the following emergency or ESF functions have been active since the onset of the COVID response. And so Valerie's team has been manning transportation, public works, fire, emergency management, human services, logistics, public health, law, recovery, and public information. We train together and are here in support of this community, but we need your help. We know we don't always get it right. There is no playbook for this public health emergency. And long after the early response subsides, there will still be the need for recovery in the community. We're asking this community to show the rest of the state how resilient we are, and that it will take all of us rowing in the same direction, but respectfully 6 feet apart. No pun intended. You know, you've asked for a lot of data and statistics throughout the response, but I also want to remind people, let's not forget that there are people attached to that information. We all know someone that is severely feeling the impacts either from having the virus, losing loved ones, or the economic impacts that are affecting people we know and love. Please take care of each other. Thanks for tuning in, and we'll be back with you next Thursday, April 9th at 2 o'clock. And also, please visit the Pitkin County COVID website. That website is designed to provide you with the most up-to-date information that we have. Thanks again for tuning in, and I hope everybody has a good day.